our breastfeeding week. What is the safety of mother and child? Can mothers actually breastfeed for 6 months as required by the World Health Organization? That is a discussion I'll be having right now with Ms. Wang Li, the Save Children Kenya and Madagascar country director, and also Ms. Veronica Kerogo, who is the Deputy Director, Head of Nutrition and Nutrition at the Division of at the Ministry of Health. Ladies, welcome to the program as we have this discussion about Breastfeeding Week with the theme Support Breastfeeding for a Healthier Planet. Let me begin with Ms. Wang Li from the Save the Children Kenya Madagascar country director. As we talk about Breastfeeding Week, what is the focus? Because this year's theme is Support Breastfeeding for a Healthier Planet.
Good morning, everyone. I'm glad to be here today to talking about this really important issue. So the kind of breastfeeding week is actually an action being called around the world to promote breastfeeding, this very important measurement for mothers and the baby around the world. And this year, with the theme of breastfeeding and the health planet, I think in a way which it doesn't seem nature for people to thinking about, how breastfeeding contribute to a health planet. But we do have a lot of numbers tell us, just for example, produce 1 kilo for baby formulas. It takes 4,700 liters of water. That's just one example of, if every mothers around the world and continue practice 6 months exclusive breastfeeding, and then following the WHO recommendation up to 2 years in terms of this is going to be the best for the baby, but also also the best for our planet.
All right. And Ms. Kerogo, you work at the Ministry of Health. You're the head of a division in that ministry. But how can the government protect and promote women's access to skilled breastfeeding counseling, and which is a critical component of breastfeeding support?
Good morning, viewers. Thank you, Brenda. Breast milk, we say it's the only nature food for infant, especially 0 to 6 months, because it's balanced. It has all the nutrients that a baby need. And as a ministry, we are promoting and protecting and supporting breastfeeding so that all mothers can be able to successfully breastfeed their children. And we have policies in place, of course, starting from our constitution. When you go to Article 53 of our Kenya Constitution, every child has a right to basic nutrition. And for children below 2 years, the basic nutrition is breast milk. And therefore, the ministry has also developed policies to support breastfeeding. We also have legislation to protect breastfeeding. We have Breast Milk Substitute Act that was enacted in 2012. And this one provides for appropriate marketing of breast milk substitutes, and also promote breastfeeding as the first and the supreme way of feeding babies. So we have that BMS Act, and it prohibits marketing, advertising, through advertising of infant formula, as we call them. Also, even other designated products like feeding bottles, cups with spout, because we know that those other methods of feeding babies may result in some illnesses, especially diarrhea.
All right. And Ms. Wang Li, we can all agree here as women that breastfeeding is a natural process, but it's not a natural process for all women, because especially for first-time mothers, they struggle to breastfeed. Some can have cracked nipples, some don't even know how to start the process. So what sort of counseling or process should these women who do not even know how to breastfeed be taken through?
Yeah, thanks. That's a really good question. And, you know, I also have my own experience because by actually working with Save the Children and together, I think with a lot of health professionals, we truly believe in exclusive breastfeeding. But as you said, in terms of, you know, when I was the first time with a mom, I still encounter with those challenges. So some of the kind of strategies we've been taking, I think, around world, including here in Kenya. So as you rightly put, I think, first of all, what we're talking about is to have immediate breastfeeding. So wherever when mother gives birth, despite if you give nature birth or through C-section, the advice is immediately to give breastfeeding. And those process and the position and the small tips, it should be supported by trained health worker. So what we call basically skilled health worker be able there to support the mother. And meanwhile, I think in terms of, you know, we have observed, I think, both in Kenya, but also around the world, so many communities, there are so many myths about breastfeeding. And there's some talk about in terms of, I have just read in terms of in some community, for example, in Kenya, they give butter before they actually give a breast milk. Or they say mother cannot breast milk, and here somebody important have named the children. So all those, I think, in terms of small hinders and obstacles can really actually stop sometimes to do not help the mother and children to continue with breastfeeding. And there will be, I think, in terms of, you know, as Veronica also talked about, breastfeeding is such a nature thing in terms of it's the great nature, that gift being given to mother and the baby. And there's also a lot of sometimes worry from mothers says, oh no, I don't have enough milk. And so I need, you know, my baby is crying. So all those, there are just a misunderstanding. We just need to provide enough, I think, you know, information, technical knowledge, wherever when the mother, there is certain difficulties, for example, in terms of, you know, the position, the nipples, and all those kind of things, wherever that, then you have health professionals be able to provide that advice. Another very important thing, I think, is the supportive family environment in terms of, you know, for example, now I grew up in the Asia culture, mother-in-law actually dictate a lot in terms of, you know, how a mother does in the family, and as well, actually, the father's attitude, whether that family environment, that community environment is supportive and encourage mother to continue breastfeeding. Breastfeeding, mom should be proud, actually, they're able to breastfeed the children up to 6 months. And well, we also have seen some challenge. Well, I think same here in Kenya, for example, in rural area, generally, I think breastfeeding, exclusive breastfeeding rate is higher than urban area. In urban, mothers have different type of challenges, especially I think around working mother. So I think another key strategy over there is around in terms of, you know, how can the workplace provide better support for breastfeeding mom. Yeah, so I think all those strategies could help actually mother, yeah.
All right, so let me bring in Ms. Keroge into this conversation before I bring in my colleague Joan Letin, who's also going to be getting, you know, the voice of Kenyan women about breastfeeding. And Ms. Keroge, about breastfeeding, exclusive breastfeeding for 6 months, it's not an easy journey for mothers, and especially women who do not have breast milk. And some have always opted to go for, you know, non-milk that can substitute the breast milk. So what sort of counseling or sort of a plan does the government have for these women? Because the only plan that we know that Nairobi County had is also the breast milk bank at the Pumwani Maternity Hospital. Is that the best way to, is it the best thing to do for mothers who do not have a breast milk, or can they go for none as a way of ensuring that their babies get the nutritious milk that they need to have for 6 months?
Okay, thank you, Breda. To start, I can say all mothers have the capacity to breastfeed. As one has said, given the proper support from the family front, they can successfully breastfeed. And we normally look at the guidance from WHO, and there are 4 key areas that we focus on. That the babies need to be immediately initiated to breastfeeding within the first hour of life, because it has beneficial effects, and it contributes to reduced mortality at that neonate age. The other one is what you have said, the exclusive breastfeeding for the first 6 months. As a country, our rate is 61% of the children are the only ones who are exclusively breastfed for 6 months. So what is happening to the 39%? Is what Breda or Wang, you have said, some meats that don't have enough milk, but we support the mother has enough milk. The other one is sustained breastfeeding after 6 months with introduction of appropriate complementary food. And the other one, of course, is the support that the mother gets in terms of nutrition and in terms of course, breastfeeding. So as a ministry, when we start from what we say the first 1,000 days, that is from the time the woman conceives up to the time the child is 2 years, we have several interventions that we put in to ensure that to support the woman to breastfeeding. So we have maternal nutrition counseling that happens, and that's why as a ministry, we encourage women when they get pregnant to go for antenatal clinic, because they'll get the counseling that is required for good nutrition during pregnancy. And when they deliver their children, they are going to get counseling in terms of breastfeeding.
So Miss Carol, allow me to cut you short. So if I got you correctly, are you saying that mother, there's a way, there's a policy that the Ministry of Health has put in place to ensure that women can start milk production even before giving birth, so that when they give birth, the babies will have enough milk for the next 6 months?
Yes, we have what we call nutrition counseling. So any pregnant mother who is visiting a health facility get access to this nutrition counseling on what to eat and how to prepare for the baby when the baby is born. And at the hospital, when the baby is born, we have what we call Baby Fredrik Hospital Initiative, and that's basically just supporting the mother how to latch the baby to the breast, how to prepare psychologically to breastfeed. Once the mother leaves hospital, we have another initiative we call Baby Fredrik Community Initiative. And this is where now the community support comes in. We have the community health volunteers who support the mothers in how to breastfeed, how to eat, and even how we also link with the other ministry, like Ministry of Agriculture, so that they are the households can be able to access food to sustain the breastfeeding for the nursing mother.
But how many women know about these support groups that have been put in place by the government?
This is happening countrywide. Health has devolved. So as a ministry, we have developed the guidelines for Baby Fredrik Community Initiative, and we have been able to train the health workers. So we are scaling it up so that it reaches all the community health units.
All right. So before I bring Ms. Wangli, let me just go to Nakuru. We're talking about breastfeeding for exclusively for 6 months. And studies have shown that more than 80% of women initiative breastfeeding, yet a much smaller number breastfeed exclusively for 6 months. Now, the modern woman is dogged by numerous challenges, including demanding careers and public stigma. So now, let's bring in our Nakuru-based reporter, Joanne Letin, who's on standby for us and sheds more light on recent experiences of lactating mothers. Joanne Letin, good morning. You're a mother like me. Let's talk about breastfeeding for 6 months exclusively. How easy is it?
Well, a very good morning to you, Brenda, and it's a very interesting week for all of us mothers. Remember, they're saying that you should breastfeed for 6 months. For some people, it was not easy, but they tried their best. But allow me now to bring other mothers in so that they can tell us the experiences they had when they were breastfeeding their children, and if at all they did for six months. Thank you, ma'am, for joining us. Let's start with your name and tell us your experience when you were breastfeeding.
My name is Neva Oluchiri. I'm a mother. The experience I had when I was breastfeeding was that I felt that connection with my child. So that when the child is breastfeeding, you can easily observe that child, the behavior and everything, and you see the child looking at you, feeling like you are really connecting. So there was that experience where you felt you are a really mother.
Did you breastfeed for 6 months?
Yes, I did. In fact, I did breastfeed my son for 2 years.
Yeah, that's interesting. Let's speak about the importance of breastfeeding. Most mothers do not understand this, and some will start introducing their children to probably porridge at 2 months. What do you have to say about the importance?
My name is Ann Muithaga from Nakuru County. What I would like to advise our young mothers or mothers at large, it is very important to breastfeed the children because it makes the immune system to be strong. It protects against cancer, diabetes, allergies. That is the importance of prolonged breastfeeding. It ensures the body immune of the child is stable so that it fights against the different diseases that may occur between the child's growth and when he's coming up to be a big child.
Let's speak about the stigma. There are many mothers who fear that when they are breastfeeding their children in public, the people look at them, they laugh at them. What do you have to say about the stigma so far?
There is nothing unusual about being a mother. In fact, everybody should be proud of being a mother. And by breastfeeding, that one gives you the sense of showing your motherhood, whether it's in public or in private. So stigmatization, I don't know where it comes from, but I believe that there's nobody who will be stigmatized just because you are breastfeeding. Because even I was breastfed, and that is why I am the way I am. So whoever is stigmatizing somebody else because of breastfeeding, I think that is the loser one. The one who is breastfeeding is the gainer because you feel that touch, you feel the love, and you feel like you are really giving the best to your child.
If you are to speak to men who laugh at women when they see them breastfeeding in, say, hotels, what would you tell them?
I'll just ask them if they were ever breastfed by their mothers.
Because that's a good question. Let's now speak about the importance of going to clinics. Most women are now not going to clinics because of the fear of coronavirus. What would you tell them?
But for the, at the moment, we find our hospitals they have the 1.5 centimeters social distance. So I don't think it's a problem to go and visit the clinics. We have our hospital have the safety regulations that they are following. So there's no need of avoiding to go to hospital. You should think about your child. And the hospital themselves, they know you have to go for checkups and everything else. So never fear to go to the hospitals because we know your children need us more. And again, about this thing of stigmatization, one thing you should know, most of the companies have allowed the women to feed their children, to come with them. Some have even built small nurseries for them. So I don't think there is a problem with that. Thank you.
If you are to advise mothers who probably fear to breastfeed in public, and those who fear to breastfeed for 6 months, some say that I will lose my shape and I'll lose my whatever. So what would you tell them?
I think it is the duty of every mother to sacrifice for her baby. So if you want to bring up a malnourished child, a sickling child, an expensive child, then don't breastfeed. Losing a shape while you are breastfeeding is normal, but you can again bring back your shape immediately after breastfeeding. So I don't see any big deal about it. What do you want to show? Do you want to love your baby or to love the world? That's the question every mother should be asking herself.
Thank you so much. Well, Brenda, you heard it from the mothers here. They have interesting sentiments. They are saying if you want to breastfeed your child wherever, just do it. Because you are bringing up a leader who is going to lead the world in the next probably few years. So if you want a malnourished child, don't breastfeed them. If you want a healthy child, please do. Back to you in studio, Brenda.
Joanetine, I know it's such a personal question. You're a mother. Did you go through 6 months breastfeeding exclusively?
I won't lie, I did 5 months.
You did 5 months. Even me, I did 5 months. Let me not lie. Exclusive 6 months is not easy. Breastfeeding. Joanetine, thank you for that, for talking to women in Nakuru County. But let me bring in Ms. Kerogo. Important things that have been pointed out, that have been brought about by those women. One is feeling the connection with the baby. and there's the also introducing other liquids like porridge, water. At what point should you introduce that? And also there is stigma associated with breastfeeding. And I like what a mother said there. Do you love the world at the expense of your baby because you're looking at your shape? Kindly give me your feedback about those things that have been raised by those women. But just hold your thought when it comes to the COVID-19 and breastfeeding, because we shall be getting into that later on.
Okay, thank you, Breda, and thank you, Eva and Nan. I think it's very good to hear from mothers who have had an experience of breastfeeding. And I just wanted to also touch on the point of working mothers, which came in. How do they continue to breastfeed after going back to work? The ministry, we have a health policy, which in Article 71 and 72 requires every employer to provide what we call lactation station. This is a place where a nursing mother, when she resumes work, can be able to express milk. There's a fridge there, put the milk so that she is able to store the breast milk the time she doesn't have the baby. And when she's going home, she takes back the expressed milk with her. So meaning in that she'll be having more milk she can store in the fridge, which the baby can be fed when she's at work. So the policy environment is very supportive for even working mothers. On the issue of introduction of complementary feeding, we have said for the first 6 months, only breast milk, not even water. Even the children the women in Turkana, where it is very hot, the breast milk has enough water to sustain the baby. So after 6 months is when we say now you can introduce the other foods, looking at the different food groups, because we are looking at the nutrients given by the different food groups. Then that one is also sustained, including continued breastfeeding. Okay, the other thing that was brought, of course, is I like the way Anne said about the boarding. When you are breastfeeding your own baby, you look at the baby. In fact, now we say previously, or the old times, mothers used to cover their babies when they are breastfeeding. We say uncover the baby so that you can look directly to the eyes of the baby as the baby is breastfeeding, and that ensures boarding. So don't feel ashamed. I don't see, we don't get ashamed of our maize store granary. So the breast is the granary for the baby. So we should not feel ashamed. On the issue of...
There's the issue of feeling a connection with the baby when you're breastfeeding, and the question is, what about women who do not have breast milk because they feel like they don't have a connection with the baby?
I think I would like to correct that myth or misconception that there are women without milk. All women have the capacity and the potential to breastfeed, but it requires psychological preparation and emotional also preparation so that the mother can be able to produce milk.
All right.
And I would like for mothers who maybe are having that feeling that they don't have milk, please seek advice from the health workers. You'll be able to be taken through the journey of how to successfully breastfeed.
All right, let me bring in Ms. Wangli. And does it make a woman less of a mother, a woman who cannot breastfeed because of health issues or because they do not have enough breast milk?
I wouldn't say, that's right to say in terms of, as Veronica right to put. One, this is a nature thing. All mother actually should be able to breastfeeding the baby. But if there is certain circumstance after they seeking, counseling and support from the health worker and so on, then they still have difficult and challenges because it can be very different reasons, health and all those conditions. But bonding with the baby, I think, especially in terms of that skin-to-skin touch, is extremely important. And Save the Children, for example, we have been doing a preterm baby program and introduced kangaroo mother care. Kangaroo mother care is because there's another myth over there. For preterm baby, they should be stayed in incubators. And the mother should not breastfeeding them. And then a lot of mothers actually failed to breastfeeding them because they're so tiny, and then they looks, a lot of mothers explain to us. They say, I don't even know how to hold that small baby of mine. And there's so many great examples where we have seen through the program where we had with some of the hospital in Nairobi across the country. Actually, that bond, psychological, I think, connection between the baby and the mother, continues of the skin-to-skin touch and the breastfeeding have significant, improved the children's surviving rate, even for preterm baby. So I think in terms of, in all means, if every single thing we try does not work, still continue that skin-to-skin bond with the baby, because that will provide a sense of safety, and then also a sense, I think, psychological bond, as the mother have in before from Nakuru have just put it rightly. Those will have a significant benefit for both the mother and most importantly for the baby.
All right. So how can a woman know that I don't have enough breast milk for my baby?
Yeah. No, I think in terms of, what Rika said, first, I think this is a myth. Yeah. So I think every mother should believe this is a nature thing. This is the right thing to do. And of course, I have enough milk because I'm a mother and I give birth to this baby. Yeah. So that should be the first starting point. And then, of course, I think there are small tacticals in terms of, often where we see, women say they don't have enough milk, it might be because of the position, how you hold the baby. It might be you have not been initially be able to breastfeeding. Veronica said, it should be within 1 hour when you give birth to the baby.
All
and
right.
then, sometimes it could be psychological stress. And if we combine all those strategies, I still, really truly believe, every mother have milk for the baby. Then they have enough milk for the baby.
All right. So now I'd like us to look at another story about, I want us to shift our focus to COVID and breastfeeding mothers. And COVID had caused a lot of disruption in many people's lives, and especially breastfeeding mothers. And now it is a matter of concern because they're thinking about their health, but also that of the newborn babies. Now, the World Health Organization recommends a 6 months exclusive breastfeeding for life, in terms of ensuring that the baby has all the antibodies that the baby require. But with breastfeeding being an intimate affair between a mother and a child, our KTN's Dr. Mercy Corrie reports that mothers have to adopt new measures that will keep their children nourished both physically and emotionally.
Is where the baby should latch. Again, we are also discouraging mothers holding breasts like this.
A mother's breast is a newborn's main meal. With or without the pandemic, mothers have to exclusively breastfeed.
Basically, breast milk has all the nutrients that a baby needs for the first 6 months. It has enough. 70% of breast milk actually is water, so babies don't even need water.
While pregnant, a new mother, whom we shall call Selina, contracted the coronavirus. She was worried for her unborn child and the uncertain future that awaited her.
If the baby came at that time, whether I'll be separated with the baby. So that was my greatest fear. Because now I will not be able to breastfeed. I want to be there with my baby the entire time.
Being among the first expectant mothers to test positive, she was in hospital isolation for 23 days. After being discharged home, she later delivered a healthy baby. But her next worry would be how to breastfeed safely.
We would all wear masks, including me. No one could carry the baby without a mask. And 2, we would disinfect the entire house, mostly daily, And at times, we could have visitors not coming to visit the baby, but to just check on the other members of the family. So whenever they came in, we ensured that everyone had a mask and disinfecting.
Those who stay with her have had to adopt the strict measures to ensure safety of the baby.
We only have 2 people who can hold the baby, and they rarely go out of the house. So for them, they can hold the baby after washing their hands. They don't have to change their clothes.
Mary Madenge, a lactation manager at Aga Khan University Hospital, Nairobi, advises women not to fear breastfeeding during this period as the milk is safe for the baby, even if they are COVID positive.
When a mother has that COVID, her body is also trying to fight there. It's actually because COVID has no cure. It's a virus. So what treats COVID is actually how your body fights for you. So your body is already producing a lot of antibodies, and that is what your baby also needs.
This year's World Breastfeeding Week is encouraging everyone to support breastfeeding for a healthier planet because breastfeeding provides every child with the best possible start in life.
So, Angli, how can women with suspected or confirmed COVID-19 safely breastfeed their babies?
Thanks. Actually, in terms of, in the previous kind of video we have just seen, according now, I think WHO recommendation and then all the health experts, number one is the mother, even when they suspected or confirmed with COVID-19, they should continue breastfeeding because the damage or the risk of do not breastfeeding to your baby, it could bring much higher than actually COVID-19 itself. And there's also, I think, in terms of, from what WHO suggested, in terms of there is no very strong so far evidence can show how that virus transmission from mother to the baby, as well, how that will be impacted to newborn babies. So I think we can take in precaution. I think as the mother in the TB have just said, in terms of, keep some of the good public health practices, both herself and then her baby. But I think continue breastfeeding, and then in terms of, continue that bond, psychological connection with the baby, that's going to be the best for the baby as well for the mother to develop and to grow, and especially in this case, for the mother's case, actually to recover. Thanks.
But as much as, Wangli, as much as we're saying that, research that has been done, and let me just quote what WHO here says. Having tested the breast milk of many mothers, I'm just quoting what WHO has written on their website. It says that having tested the breast milk of many mothers around the world in a variety of studies, the WHO explains that although a few samples had contained the virus, just a few samples, when they followed up to see whether the virus was actually viable and could be infective, they could not find any actual infective virus in the baby. So, but there is a concern by some breast nursing mothers that their chances of spreading the virus through respiratory droplets or contact with the baby, especially when they're having that eye-to-eye contact. And probably some mothers would like to speak to their babies, and droplets, there it goes, the baby can get the virus.
I'm not, first I have to disclaim I'm not a COVID expert, but I think in terms of, from so far, I think in terms of, what the data and the research have showed, those risks are minimal. So we have to look in terms of, the risk of do not breastfeeding and compare the risk of actually transmit the virus to the baby. And then also in terms of, because coronavirus is new and there's still a lot of research to be done. It's actually one of the experts have just said in the previous video that everybody who is in contact with the virus in terms of positive, your body are actively fighting and produce actually those anti-cells and all those could be also a very good source to boost the immune system of your baby.
All right.
Yeah.
All right. So, Ms. Kerogo, there is a proposal that breastfeeding mothers can wear masks, you know, when breastfeeding their babies. But the connection, the sort of physical appearance that the baby will be getting of the mother who's wearing a mask, how will it be portrayed? You know, the connection between the mother who's wearing a face mask, who's breastfeeding the child.
Okay, thank you, Brenda. And I want to also emphasize that even with a confirmed COVID positive mother, breastfeeding is recommended. I know there are so many fears, but what we are saying is that we have, as a ministry, we have issued guidance on COVID breastfeeding in context to COVID. And the key things to remember is the infection prevention control measure that the ministry has been preaching. One of it is washing hands. So the mother should be able to wash hands before and after handling the baby, and after breastfeeding or after expressing breast milk. And of course, wearing the mask, because we know that is the physical barrier of the droplets. And of course, the baby may first of all have, get a bit taken aback. But with time, the baby will get used, and of course, when talking to the baby will recognize that's the familiar voice. So
right.
The mother should be able to wear a mask. In case the mother is not able to breast milk, to breastfeed, then we recommend that she be supported to express the breast milk. Of course, observing the infection prevention control measures.
All right.
And this expressed milk is put in the cup, and the baby is fed using an open cup.
All right, and I was about to ask Ms. Wangli about that. What if the mother is too sick to breastfeed and yet the mother has breast milk?
Yeah, so I think I will echo what Veronica just shared in terms of, there's also ways which to do this safely express the milk in terms of actually supporting continued feeding the children. And also I think early on you touched the base about in terms of breast milk bank and so on. Those are some of the initiatives to really support, I think, really sick mother who cannot breastfeeding their own children and have, because of different reasons, and then can steer the baby can access to breast milk.
All right. And let's also speak about the reality of breastfeeding mothers who have terminal illnesses like HIV and AIDS. Let's talk about such kind of mothers who are positive of HIV and AIDS. How can they breastfeed? Because so far, I stand to be corrected that mothers with a low viral load of the virus can breastfeed. What about mothers who have a high viral load? Can they continue breastfeeding?
Is it that question? Oh, sorry. Go ahead.
Okay, Wangli, go ahead, and then I'll have Ms. Kerogo respond after you.
Okay, yeah, thanks. I think in terms of, as you rightly point, HIV, AIDS, and have been there for much longer compared with coronavirus. There is a lot of technical guidance being established, I think, both in terms of, how can HIV positive mother to give birth in a safe way, also continue breastfeeding and support the children and so on. So there are safe ways, and they are actually tested guidelines around the world. And I'm sure also in terms of, here in Kenya, we have had many successful cases as well. Thanks.
All right, Ms. Kerogo.
Yes, I concur with Wangli that even for HIV positive mothers, the general recommendation, and we have also guidelines for that, is that they should continue breastfeeding just like HIV negative mothers. And it's because the benefits of breast milk actually outweighs the other issues. And of course, that's why we recommend also HIV positive mothers to continue with taking their children, babies to the clinic, because that's where they'll get their advice and also ensure that they are taking the medication as recommended so that the viral load is minimized.
All right, and Wangi, what would you like to tell breastfeeding nursing mothers who look at it in terms of substituting? They feel like, oh, my child is not getting enough milk, or my child is getting enough milk, but my child is not satisfied, my child is not full, so I need to substitute. I give breast milk, and at the same time, I can also give milk, the dairy milk.
I think for me, what I would really encourage all the mothers who maybe may be feeling they don't have enough milk, it is more in the mind. It's therefore good to, first of all, psychologically prepare that as a mother, you have the milk. And we know the more you breastfeed, the more the milk flows. So the key thing is breastfeed, 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 and the milk flow will be sustained.
All right. And Wangli, this is a very interesting question that I'm about to ask you. You had my colleague talk to Anne in Nakuru, one of the mothers who did exclusive breastfeeding, saying that she breastfed the son for at least until the son turned 2 years. So when is the best time that a breastfeeding mother can say enough is enough, now you can do dairy milk?
Yeah, so I mean, in terms of as simple as the first 6 months, you just exclusive breastfeeding. There's no need of water, no need of any additional food. Of course, I think it's important for breastfeeding mom to be a very good fit, because you need to have a good nutritious, be able to produce, I think, in terms of nutritious, enough nutrition for your baby. And then I think there is additional supplementary feeding introduced after 6 months. A WHO suggestion and so on is up to 2 years. That will be quite good for your baby. And I want to come in, add a little bit more on, some of my observation, I think, while I was working in Asia, around actually some of the marketing behaviors about breast milk substitutes companies and so on. So while there's a phenomenon we're seeing in Asia, actually a lot of women, one is that worry about, oh, I don't have milk. But another one is really because of wrong advertisement and the wrong message being given to mother, and they truly believe actually baby milk formulas are better, they can make the baby smarter and all those. So that we have been seeing violation of marketing code of a lot of baby formula companies around the world. And we're seeing that it's tremendous, actually. You're seeing really in a lot of lower middle income country, even for rural mother, now they feel, oh yes, because all the mother in the cities, they can afford those baby formulas, so they can make the baby smarter. Now we have to start copy them. They spend a tons of money and actually are going after because of the influence by the market. And then those behaviors can lead to a devastating impact around diarrhea, around malnutrition, and the other child health problems, and so on. So I really hope, actually, in terms of, I know Veronica suggested, shared before, we have the code in Kenya, which is effective from 2012. And so far, I think in terms of, we have been very much kind of supporting that code implementation in country. Everyone, all of us, we should play our role to support and monitoring those code implementation, because business can be very smart, they write so, but I think in terms of when they do marketing promotion, they have to be strictly follow the marketing code, and then pass those information to the mother. Actually, breast milk is the best for your baby.
All right. And you bring a very important point about cleanliness when it comes to breastfeeding. And this year's theme is support feeding for a healthier planet. And as we wind up, I'd like to give you a minute each, ladies, for your feedback when it comes to this question I'm about to pose to you. In terms of storage of breast milk, and if you remove your breast milk from the refrigerator after it's been thawed, can you take it back to the fridge and use it later? And if you're not taking it back to the fridge, if a baby has drunk the breast milk, left a little bit in the bottle, can the baby still be given the same milk later on? I'll start with you, Ms. Kerogo, in a minute, and also as Ms. Wangley would wind up.
Okay, thank you, Brenda. We normally say that when the milk is expressed from the breast, even for women without refrigeration facility, it can stay in room temperature, maybe in a water bath, for at least 6 hours. But for the ones that maybe one has expressed, you have put in small package and frozen them, once it's thawed, that milk should be fed to the baby. If the baby does not finish, you throw away, because there are chances of contamination that can happen. And you see, we don't want to have diarrhea episodes that will really derail the gains of our breastfeeding. So once it's thawed, feed, the leftover, throw. So the recommendation is because mothers are able to know how much a baby feeds per any feeding time, is to store milk in such quantity enough for one feed, so that you are also minimizing the waste.
All right, Ms. Wangley, I don't know what to say about that, because for me, I never threw what remained, because I looked at breast milk as gold. It's it's gold, and getting it is so hard.
Yeah, so I think in terms of, Veronica have put it very clearly in terms of, there is for the fresh expressed milk, and there's a certain, 6 hours, and then when you defroze it, you put it in the freezer and defroze it, and then we have to really pay cautious in terms of the clean hands and in fact clean cups and all those, to avoid to have any other risks of encounter with diarrhea and contamination of the breast milk and so on. Yeah, no, I'm with you in terms of, I, as a working mother, I have expressed milk and the carry, and then, but at the end, you have no choice actually to throw it. But meanwhile, we know if you continue to express your milk as a working mother, then you can sustain that continuous bond with your kids and feed your children much longer, even while you are returned to work.
All right, ladies, I know we are supposed to wind up, but let me just get your thought on this question in a minute each. Let me begin with Ms. Wangley. What is your thought about women who cannot breastfeed giving breast milk that belongs to another woman to their baby? Because there's a program by the Nairobi County government of the milk bank at Pumwani Maternity Hospital, and there are women who are afraid of taking another woman's breast milk to give to their baby.
Yeah. I think in terms of, for any breast milk bank project and all those, is there from a principle or from really to promote breastfeeding, and because every mother believes the breast milk is best for the baby, and then there should be certain kind of control mechanisms in place in terms of both, I think, with what kind of milk and the health condition of the mother, but also most important, I think, is the storage in terms of to avoid any kind of contamination and the control of the in terms of either, I think, the temperature and all those. But then when we actually give to the baby in terms of the containers and so on, those have to be kept extremely clean to avoid any other infection as well. So I think it's for those are just general good public health hygiene practices. Anyway, even if you're breastfeeding your own children or through other means, through the breast kind of milk bank and all those, it should be observed. Once you observe all those good public health in terms of practices, then it should be safe.
All right, Ms. Kirogo, we've run out of time, but ladies, I just want to say thank you for your feedback, your sentiments about this year's theme of supporting a healthy breastfeeding week. This week, Kenya joins the rest of the world in celebrating the World Breastfeeding Week. And we had Ms. Wangley is from the Save the Children Kenya and Madagascar County Director, and also Ms. Veronica Kirogo, Deputy Director, Head of Nutrition and Dietetics Division. I hope I got that name correctly, pronounced it correctly, at the Ministry of Health. Ladies, thank you so much. My name is Brenda Zedaradido. I wrap it up. Goodness. I wrap it up for the first hour. I see you again at 10 a.m. for more news making the headlines here.